Alejandro Quiroga, the Section Chief of Pediatric Nephrology at Helen DeVos Children's Hospital. Thanks to the work of Dr. Quiroga and his team, the nephrology program has been recognized as one of the best in the country by U.S. News and World Report for 4 consecutive years. Thanks for joining us today.
Thank you very much for having me.
So how did you get into nephrology?
Well, I love the question actually, because I think in my field, I love that I can influence patients in different areas. So we see patients in the outpatient clinic, we see patients in the ER, ICU, the floor, and our worst case scenario, which it's unfortunately when kids have a chronic condition, our worst case scenario has a lot of hope built into it. And the worst case scenario, you're gonna get a transplant, you might bridge that with dialysis, but then you'll be fine. And it makes a big difference when you're working towards that kind of outcome. It's very encouraging.
So tell us more about you and your team and what kind of things you guys do to help kids.
Well, it's almost unfair that I'm being the face of my team, because I don't think I can do due diligence to all the great things that they do. We do have an amazing team here. And I think we're lucky to have the kind of resources that we have here. When you think about pediatric nephrology, it's a very small community. There's only 800 pediatric nephrologists in the country. So having 3 here, soon to be 4, is a good chunk of those 800 nephrologists for not a lot in the country. What we can do with this team, with all the nurses, dietitians, social workers, technicians, physician assistants, we're doing transplantations. We're soon to reach 50 transplants with great outcomes over the long term. We're doing dialysis, as you can see here. We're sitting in our freestanding pediatric dialysis unit, which is also rare. A lot of dialysis units that take care of kids, they're embedded in an adult dialysis unit, and it's different. Here our kids are going to school when they're in dialysis. The staff that works with them are child-friendly. We have child life specialists that come and work with them. They have to be seated for 4 hours during a dialysis session.
Long time for a kid.
Yes, it's like a very difficult thing to deal with. So we do dialysis, we do transplantations, we deal with all sorts of congenital problems that involve the kidneys. We have a 360 involvement with anything that has to do with the kidney. We support other big teams like cardiothoracic surgery. A lot of those kids need dialysis post-surgery, so all of that.
Wow. How common is our problems with kids and kidneys?
So I think there's a big range. There are a lot of common congenital abnormalities of the kidney that are not usually very serious, to very rare kidney disorders that tend to be more serious. So a lot of the times, for instance, in 2% of all pregnancies, you're gonna find some sort of kidney abnormality, anatomical or structural problem. That tends to be a lot of our bread and butter, and most of those kids do really well. But embedded in that 2%, there's some serious cases that we need to really catch on time. And there's some extremely rare disorders that, because of the area that we cover, we tend to see frequently, but they're extremely rare in nephrology, yes.
And so what are some of those?
So we see patients, for instance, with atypical HUS, which is a blood disorder that ends up affecting your kidney. That is a very difficult condition for families to deal with, because you don't get a heads up, your kid is doing fine, next day you're almost in like full-blown renal failure, you need dialysis, but there's some good medications to treat that. We deal with patients that have conditions that will turn your kidneys into stones. That's very rare, but we have a handful of patients. We're very proud of our tuberous sclerosis clinic. It's a genetic disorder where you have benign tumors everywhere in your body. And a third of those patients have it in all family members. So we have a clinic with the neurology department, and we see those patients together because the brain and the kidney is the most affected organs. We have 60 patients with tuberous sclerosis. We have a family that comes from St. Louis, Missouri to see us. We have a handful of families that come from Wisconsin, from Chicago, Detroit. It's becoming a very well-recognized clinic in that community.
Wow. So are some of those factors, some of the rare conditions you treat in addition, do you think that is what contributes partially to the U.S. News and World Report ranking, or what do you think is part of that?
So when we fill out that survey every year, there's a lot of things that go into it, and I think it's a well-designed survey to try to understand the scope of what you do. So it looks into outcomes of dialysis, outcomes of transplant, volumes, outcomes for post-renal biopsy, and all of those things are in place. They also look at staffing. How many of those rare conditions do you see? Are you truly being engaged in those rare conditions and having good outcomes? And the answer is yes, and that's what contributes to it. And obviously an amazing staff that can take care of all those things.
Wow. So what advice do you have for parents who may have a child or children with kidney or urinary tract disorders? What would you say to them? What kind of advice or encouragement do you have?
So, I mean, it's a great question. The first thing that I'll say is that we're here. We can see you. And you don't have to rely on Dr. Google to take care of your answers and your questions. That's what we're here for. We do not screen our referrals. We're not micromanaging that. If someone tells you that you need to see us, we will see you. We want to answer those questions, and it's great. I mean, like this week I had a couple of families that come and there is some minor kidney findings, and I'm just able to reassure them enough and tell them what the roadmap is going to be, and that's it. That is a great day for me too.
Awesome. Well, thanks for all you and your team are doing for patients and families, and thanks for taking the time.
Oh, thank you very much.